Hi, it's Ber from NutritionWithBer, and I hope you're all well and healthy, and thank you for watching. So this is part one of a two-part series on ADHD and wellness, and how we can try and navigate that through a balanced path to thrive using nutritional therapy, and also the use of pharmaceuticals, which would be the side that would be dealt by your healthcare provider, your GP, your consultant who you're under. But from my side, my point of view, I'm going to look at the nutritional side of things, as I'm a nutritional therapist. I am also a nurse, so I understand the pharmacological benefits for some people who have ADHD as well. But I kind of wanted to give you some tools that you might actually use at home in everyday life that actually could help bring more balance and peace into your life. And I also wanted to heighten the awareness of ADHD and how difficult it is for an individual who has ADHD, whether they have been diagnosed with it clinically or undiagnosed. It is something that's out of their control, and it's something we need to be very empathetic towards to help them thrive in our society, which is full of distractions and busyness with lots going on. Because, I just think if you think of life now as we know it, I mean, you couldn't imagine going back to my life where I was brought up in the country, with one house in the road and nothing else around, any fields and animals. Whereas now we live in very urbanized areas. We all have cell phones. Children have iPads and cell phones at a very young age. And on that cell phone, there will be messages popping up. So we're not just looking at one thing, we're looking at several things at one time, which creates all this turmoil and excitement in the brain, and kind of drives this behavior even further and exacerbates it. So I'm hoping you'll enjoy this. I do have a tendency to witter on a little bit too much for my own good. But I hope you can bear with me. As I say, it's in two parts. So this is part one. And let's just try and get through the slides now. So my next slide is just an overview on what ADHD is. And I think everybody knows it's attention deficit hyperactivity disorder. It's a common neurodevelopmental disorder affecting 8% to 12% of children worldwide. But the important thing is, remember, it's a complex disorder. It's not something to be ignored. You should work with a professional, get the clinical diagnosis, and also work with a nutrition therapist, because they can really help you with the nutrition side of things to unravel what's really going on with your child. My next slide is looking at the types. Now, there are more than these types, but these are the general types. And there are lots of other subtypes, but I thought we would just do the general types. And the first one is hyperactivity and impulse. So the person that kind of is, they're all self-explanatory. The person who's hyperactive and impulse, you might see them, the leg is moving all the time, their head's moving, they're fidgeting, if they're in class, they can't sit still, they have to move around, so they might be wanting to go to the toilet all the time, or they interrupt all the time. And I'm guilty of that, interrupting, especially when I would be eating a more higher carbohydrate diet. I noticed that, I'd have a thought come into my head and then I would blurt it out in the middle of somebody talking. And I wouldn't mean to be rude or offensive to that person, but it just happens. And I do notice, when I eat a lower carb, 20 grams or less, my thought process is much easier. I have less going on up here, and I find I can listen better. I have less communication, less voices in here, if that's the correct way to explain it to you. It's a funny thing when there's lots of chatter going on up here. It's hard to actually then really focus on what the person is saying. So that's the hyperactivity kind of type individual. And then there's the inattentive. So there's a daydreamer who kind of just, it's a kind of an escapism where they just go into their own daydream. Somebody once said it to me, it's like the Tigger and the Eeyore, which I think is a really, really great way to describe it. And I'm more of a Tigger for sure. But I have met plenty of Eeyores who their escapism from the social environment, whether they're overstimulated, can be to lose themselves by going into a daydream. They can also have difficulty keeping on task. They have poor listening skills, difficulty with organization. So, the workplace can be challenging for them. And then we have the combined type, which is here, which is a combination of these two, which I don't need to say anything about that. Again, I really want to really drill down the fact that we need to be empathetic to people who have any of these tendencies. They cannot help it. They're often misunderstood. They're often seen as troublemakers. They're certainly not. They're often seen as rule breakers. They are not. They're just looking for that something that gets them that adrenaline rush almost to keep them focused and to keep them interested. That might not be the right way to express it. So I think is really trying to understand where that person is coming from and what we can do to help them feel included and part of the community. So my next slide is the characteristics of ADHD. So we've kind of talked about some of them, the motor hyperactivity, the poor attention, distraction, impulsive behaviors, learning disorders, challenges with relationships. Early diagnosis is really important for children. And so children as young as 4 showing probable ADHD behavior faces challenges in schools. So they, struggle with academic performance, classroom behaviors. Again, as I say, having sick days, they might have more sick days than a normal child because they don't want to go into school, because school is a very stressful environment. If you think of a school environment like a work environment, there's lots going on, there's lots of people around. That can be very stressful for an individual with ADHD, for them to find their place in that environment. And then to have to sit still on top of that is very, very difficult. So it's really important that we understand that that it is a condition, and it is a condition that affects the well-being of the person and their development. Another part of that condition is delayed sleep phase syndrome, which I've put in here, which I'm going to talk about now in the next slide. Because that's kind of when we don't sleep, we actually miss out on so many processes that happen in sleep, which I'm not going to talk about here. But when we're resting and sleeping, the body is in a state of detox, and that's kind of clearing out all the crap from the day. So there's that side of it. So the detox processes are not happening, which is really important for health and reducing inflammation. Another part of it is that it's a real condition, this delayed sleep phase syndrome. My son has ADHD, and it's very difficult for him to sleep at normal hours, what you might think, 10 till 7 or 10 till 6. He has always been push to 3 or 4. That part of I don't have that with ADHD. I'm actually an early riser, so that's not, so I have tendencies, I would say, rather than a diagnosis of ADHD. My son has a diagnosis of ADHD. And so for these people, social hours of sleep, their circadian rhythm is really disrupted. So their internal body clock is almost in a delayed pattern. So they do better if they, or they feel better if they go to bed at like 3 or 4 in the morning, and then they get up at 1 or 2 in the afternoon, and they feel more rested. But that's not normal society, unless you're doing a night shift or an in-between shift between days and nights. It's very hard to actually feel refreshed if you're going to bed very late and you're getting up early. Then that kind of also then that exhaustion that one feels when they're not getting enough hours sleep then exacerbates and heightens the symptoms of ADHD, the inattention, the hyper excitability of the person, the reactions that they, how they react to situations is all exacerbated. And that's actually, sleep is important for everybody, no matter what condition you have. None of us can perform 100% if we're sleep deprived. So that's the delayed sleep phase syndrome. So they tend to like to sleep later and get up later. So it's for parents, to understand compassion here. You trying to get your kid to go to sleep, but they don't want to go to sleep because now they are energized. This is the time leaving, they're energized. And then you want them to go to sleep, but no, that's not going to work. So you have to work with it. And there are things we can do to help calm the body down before we go to sleep. So actually you can hopefully pull it a little bit closer to, further back towards a more appropriate sleeping pattern for the individual, especially for children. And then there are 2 other conditions that are fairly common with the sleep disorder pattern with ADHD. One is obstructive sleep apnea. And obviously, if we're feeding our kids junk food and fast food and processed foods, high in omega-6 oils, the seed oils, which I always talk about, and high in sugar, then there's an increased risk of diabetes, an increased risk of obesity, and there's a strong link between those and sleep apnea. The other condition is restless leg syndrome, which, there's a genetic component to that. So if you ever had restless leg syndrome, I have the genes for the SNP for restless leg syndrome. And I used to have it a lot when I was in my younger years. And you kind of feel like you could chop that foot off. But again, the low carbohydrate diet has really kind of done me so many favors. Things that I've forgotten that I used to have now disappeared. The other thing that needs to be considered with restless leg syndrome is iron deficiency. It's very common. So that's something, we need to look at micronutrient deficiencies, which we'll do later in the slideshow. So these are common characteristics in sleep with people with ADHD. So I'm going to move on. And the prevalence of sleep disorders in ASD is about 50 to 80% in adults and 40 to 80% in children. So, it's like, if you think it's up to 80%, that's huge. So how, we can expect our kids to actually achieve at school if they are in that cycle of disrupted sleep. Then this is the global prevalence of ADHD. The representation is global. And so if we look, we can see the US is kind of top here with 8.1%. They've got Northern Ireland in as the number for of Britain. It's 3.2. And then Belgium is 2.9. But then if you look at places like Italy, 0.9. China 0.7% of the population, Romania 0.4%, Poland 0.3%. Now there could be that in the US there is a lot more awareness of it to maybe other countries, and that they're actively diagnosing it. So it's the data isn't always an exact replication of actually what is truly representative of globally. But the US is big in the news and how it's affected by ADHD. It affects approximately 6.1 million children. That's according to the Central Disease Control in 2020. And the trend from 2003 to 2011, the childhood ADHD cases increased by 42%, almost like by 50%. So, you know, again, they're saying this raises a question about the validity of the diagnosis of the cases, or does it raise a question about what's happened, you know, to our children in that time with all the electronics, you know, being given at a much younger age, more processed foods, you know, higher sugar diets, lack of exercise due to the fact that we're now sitting on our phones and our iPads and playing games more actively. So, you know, it could be questionable whether it's actually what's actually happened in that time period socially to us, or was there an overdiagnosis? How did they make the diagnosis? So, I mean, it's alarming, and it's something we need to be aware of. So that's a nice little representation of what's going on. And as I say, you know, it's not maybe truly replicable, because some countries will be more advanced in their testing and be more active in their testing. And I imagine some of that's what's happening in America. So the next slide I have is about the UK. So 56% of children in America with ADHD diagnosed are on medication. 62%, so you can't do that. 62% of children in America are on medication. 62% of children with ADHD diagnosed are in receipt of medication. So that was in 2020. So yes, so 56% in 2003 were at the receipt of were having medication in 2003, and then by 2020 it's gone up to 62% in the UK. So 54% of adults in the UK since 2011 with ADHD diagnosed with medication. So it's kind of going back in the years. So over 2.6 million diagnoses with ADHD. Boys are more likely to be diagnosed than girls at 13% compared to 6% of girls. However, the literature now is saying that girls are not being diagnosed, they're being missed. So that's probably not truly reflective. There are probably more girls with ADHD than that 6%. In the 31 months period since the implementation of lockdown, 5.34 million more CNS, so central nervous system stimulants, so that drugs that are prescribed for the nervous system, which are the medications for ADHD, there was 5.34 million more of these drugs prescribed for ADHD between March 2020 and September 2022 during lockdown. I mean, that's kind of shocking. And there was I think over 2 million medications prescribed for as antidepressants during that period also. So, you know, we do know now the fallout from lockdown is huge, and the effect on mental well-being is huge. And I just kind of want to reiterate that, you know, we need to be empathetic to people with ADHD. There's lots of support sites like the ADHD UK, which is that one I have up there. But as parents and as colleagues of workers, we do need to support people who have this condition. The next thing I wanted to say, well, maybe the difference in the numbers between the 8.4% of the US people suffering with ADHD compared to Europe, who has a little more lower percent, is maybe it's something to do with the diet. And I've lived in Canada and over the border from America, and you know, back then I was a personal trainer, and I've always been a nurse since I left school. I became a nurse, so health has always been something that that I have valued. And obviously, because I have got multiple autoimmune conditions, I'm really reactive to foods. So I constantly look at ingredients, and, you know, anything that has a long list, I'll definitely, you know, switch off and I won't look at. But this was from the Daily Mail, this paper, the Daily Mail. You know, they highlighted the difference between foods. There was lots more, but I didn't want to go over the top. You kind of get the general idea. So, for example, tomato ketchup, you can see it's got high fructose corn syrup, natural flavorings. And if you look, you know, the UK has a much shorter list of ingredients. There's no corn syrup and there's no high fructose corn syrup. So, you know, we all know now that high fructose corn syrup and corn syrup is linked to obesity. It's linked to inflammation. It's linked to diabetes, and a whole cascade of conditions which are inflammatory and cause metabolic disease. So that, you know, putting that into the food actually makes you want to eat more of it, and it's just pure garbage, really, for our health. So again, looking at Doritos, the UK version, it has color, but it doesn't have the red 40 or the blue 1 or the yellow 5. Now these artificial colorings are banned in the UK. And the reference is down there from the commodities commodities.co.uk. They have listed these ones as being banned and seen as detrimental to our health. If we look at red 40, it's made from petroleum. My goodness, I mean, who would want to eat that? It's kind of scary. So again, it's trying to highlight maybe that the food we're putting into our bodies could be the source of some of these cases for ADHD. Obviously, there's a strong genetic component, but it's maybe not all the cases. For some of us who have ADHD tendencies, if we stay away from these kind of foods and eat, you know, whole foods with one ingredient or, you know, maximum 3 ingredients, and it's not a man-made substance, we have a better chance of being in a calmer state, and our brains will function more optimal. We'll be much more productive in life and take less risks, hopefully. Again, the Quaker Oats, again, that had the difference between the two. And, you know, it's interesting because these are companies that are making these products differently for the UK to the US. And that one had also the red 40 in it, which is banned in the UK. So, you know, again, looking at what you're buying in the shop is really important for your kids, for their well-beings. And it pays back to you, because obviously if your child is not able to sleep until 3 and 4 in the morning, and then, you know, in the morning they wake up and they are not going to be nice, they're going to, you know, play up, they're going to, you know, overreact to situations, and then this is where the vicious cycle gets. You know, you then as a parent will maybe get more irritable with them, and that feeds into their ADHD. So as parents, when we get annoyed with our kids who have ADHD and we're really super strict with them, that actually even fires it off even further, and it exacerbates the problem. It's not helping the situation. So that militant style parenting is really something that's a negative behavior within in a family. It's a negative behavior anyhow, but and it's something that's, you know, very old school. I was brought up under a fairly militant style parenting, and I don't think it actually helped me to actually grow as an individual or to have my own identity. I never felt self-confident. And I think, but that was very much that generation. They didn't, you know, that's how they did it. And it was almost a survival instinct because, you know, life was tough back then after the war. Well, after the war, I have to highlight. But, you know, when they were growing up, it was after the war. And then they went off to work. And then they had my generation, you know, who are now in our 60s, 50s, 60s. But now I want to kind of encourage parents who are watching this that militant style parenting is not helpful to your child. It will actually exacerbate the problems that your child is suffering. It will exacerbate and heighten their anxiety. It will heighten their tendencies for fidgeting, distraction, and they will look for things that will make them feel better. Foods like this, high sugar foods, they will crave that because that's going to make them feel better. And we'll see later why that craving for sugar, that craving for technology like gaming and doing, you know, all those addictive type behaviors is really something that people with ADHD crave. We'll look at that a little bit later. Sorry, I've wandered off a little bit on a tangent there. So the next one is basically, it doesn't differentiate. It affects everybody worldwide. There's not one particular ethnic background that is affected more than others. So this disorder does affect many people, and some people actually who have ADHD, like Bubba Watson, who's the golfer, Nicole Adams, who's a boxer, Heston Blumenthal, you know, there's a whole list of them here, Mike Phelps, Jamie Oliver, will.i.am, Britney Spears, and you know, while some of those have had disordered behaviors and have got themselves in trouble, they also have been able to hyper-focus and be very successful. And that's the gift that ADHD gives us. It allows us to become very hyper-focused and get that very tunnel vision. And I've always had that. I, you know, can push myself to the bitter end on many things. And I have that mindset to keep at it, and that's why I've, you know, that's why I've actually been able to do the careers that I've chosen. And I guess you can see I've been, you know, in my life I've been a nurse. I have done Color Me Beautiful therapy. I've been a personal trainer. I have been an air hostess. I've had a children's music group. I've been a mom, and I'm still a mom, back to nursing, and now joining it all together with my degree in nutritional therapy and bringing my personal training experience and my nursing experience all together has been my journey to date. I don't think it's going to stop there, but did I get bored? Do I need to move? We've traveled quite a bit, we've moved quite a bit, and some of that's been driven by me and my need for change. And I think that's very much part of me with ADHD, you know, needing something new, needing something to get that adrenaline, to get that excitement, to keep me engaged. But I don't know why I actually went off on that tangent, but it does allow us to hyper focus, and this is what's allowed me to do this presentation and spend all this time researching on the subject of ADHD. I'm passionate about it, and I'm very passionate about health, and I'm very passionate about nutrition as the basis for how we actually minimize all the metabolic diseases we're facing and all the neurological conditions we're facing in the world today. And I'm hoping by doing these videos that I will inspire some of you. I know I won't inspire all of you, but even if I inspire a small percentage of people who have ADHD, or who parents who have children with ADHD, to really look at how we're setting our kids up with our diet, our lifestyle choices, then we may get some change, and that's my hope. But going back to this slide, these people have all been very successful, so there's no reason why you can't be successful, but you can also get yourself in a bit of trouble on the way, is part of the ADHD traits. So my next one is on the brain and ADHD. So if we look up here, these are the lobes of the brain. We have the frontal, the parietal, and temporal, and occipital, and there's the brainstem. So dopamine is a neurotransmitter, and it's key in ADHD, and it's the one that of the neurotransmitters that actually is being researched the most as to the cause of ADHD. Now, the exact science of it is not understood, and it's very complex. And dopamine is very interesting neurotransmitter, and it's all our neurotransmitters are made in the gut, and we'll talk about that a little bit later when we're talking about the good nutrition. But I'm always talking about the gut and gut health, and so whatever goes on in our gut will affect our brain. So that's an important thing to remember. But dopamine was kind of, they say it was in Gothenburg in Sweden when they just kind of discovered what dopamine did, or that they discovered dopamine. And they actually had given rats a drug called Respirin and Respirin. I might be saying that incorrectly because I'm dyslexic. Probably am saying it incorrectly. You could look it up. And this drug, actually, when they gave it to the rats, it actually caused almost like a paralysis, so lack of movement and a sedative state. There is a name for that condition that actually happened to them. But then what they saw was after they had given the Respirin, they actually gave a drug called levodopa. Now, levodopa is a drug that's used, well known, in Parkinson's because it increases dopamine. And obviously, we know with Parkinson's, it affects the neuromuscular system. So it affects, walking, gait, all of that. And when they gave the rats the levodopa, within 15 minutes, they actually saw, which I think is fascinating, they actually saw the movement. They gave it IV, and they actually saw that the rats woke up and they regained their motor function. So that's kind of just an interesting side note, and I thought it was really interesting. So I just want to share that with you. So what does dopamine do? So dopamine is the reward center of the brain, and it's in the frontal lobe we're looking at mostly for the dopamine. We'll see later where it fires off from. But the role of dopamine, it's involved in organization, paying attention, decision making, problem solving, memory, judgment, attention, impulse control. So, all the rational things that you would need to do in life to make decisions, behaviors that you need to be rational, those are all fueled by dopamine. But when that level is low, which is what happens in ADHD here, it can be low or it can be high, but more often than not, they think it's low. And then that's when that person goes off looking for other things like drugs, like alcohol, like sex, to fill sugar as well. Don't forget the sugar, because that's key, to fill that dopamine void. So what actually happens here is we have and I'll have a slide which is going to go through the impulse from one side of the nerve to the other part, which triggers that activity. But basically, you have the dendrites, and then it could be low or high. And then these are the dopamine receptors, D1 and D2. Now, there are 5 of those, D1 to D5, those family receptors. But if it's low, then you get the result effect of this is inattentive behaviors, hyperactivity, impulses. And the other thing is that there is an enzyme called, I have to look at my notes now, beta hydroxylase enzyme. I do need prompters, my notes. Sometimes I can forget little details, but I know that there, I can look it up and I'll have the answer very quickly. So beta hydroxylase enzyme can be ineffective in the conversion of dopamine to epinephrine or noradrenaline. I think it's called noradrenaline, because I always get the epinephrine and the noradrenaline mixed up, but it's noradrenaline. So if there is a defect in that enzyme, then that conversion doesn't happen. So even if you have the dopamine, you need the conversion to make the norepinephrine, and then that's where it can be a problem with people with ADHD. So, and then with the normal brain, it actually binds. So in the normal case here, it binds normally and it regulates the attention and keeps everything nice and calm and focused and productive. So that is dopamine, which is a key molecule in this whole talk. There are others which we'll talk about as we go through. So this is your dopamine molecule. So it regulates motor neurons, spatial memory, motivation, reinforcement learning, maintains the chemical balance within the central nervous system, and excess or deficiency in dopamine is linked to mental disorders like depression. So it's hypothesized. The hypothesis suggests an imbalance in dopamine levels as the cause of ADHD, but it's complex and the science is not clear. In vivo studies on dopamine levels in ADHD remain inconclusive, possibly due to the methodology variation and sample difference. And this, is always an issue when we're looking at studies to do with many conditions that are neurological. It's never clear-cut. Because obviously, there are the controls are maybe not as well regulated as they should be, or they haven't thought out the process of certain things that should be removed, certain, factors. So it's not conclusive, it's inconclusive. So further studies need to be done, and I've just whittled down too much over that part. So if we look at the brain again here, I thought this was an interesting slide and a nice slide for you to see where the dopamine is produced in here. It's the substantia nigra, which is in the midbrain, the brain stem, and that's responsible for motor control and coordination. And then if you look here, there's also some more here in the ventral tegmental area, so VTA, which is the reward and motivational area. So then you can see where these all then feed off into, and there's quite a bit here in the frontal cortex, or the prefrontal cortex of the brain, which is the frontal lobe of the brain. And that's the area of the brain that's mostly affected by ADHD. So hopefully that kind of helps you kind of understand where it is, like it's the brain stem and then goes off into the frontal lobe mostly. That's the dopamine. Obviously, dopamine is a huge area of discussion in science, and there's a lot more I could say about it, but I'm trying to keep it simple and I don't get myself all confused either. Then I'm going to mention two other neurotransmitters. It's glutamine and GABA. Glutamine is a really important energy source for the brain. Glutamine converts to glutamate and then converts to GABA through a number of processes and enzyme reactions. So the reason I'm mentioning glutamine and GABA is there is some study around them and having a role in ADHD. And there's something we can do within our control to actually balance the glutamine and GABA ratio with diet and lifestyle factors. So glutamine is excitatory, so causes that excitement, and certain foods can do that because they have glutamine-like substances in them, or glutamine in food, like MSG mimics. I talked about that in my previous video. Mimics glutamine and how it has a similar effect on the brain. So here we can see the glutamine is the red, and again, all firing to the prefrontal cortex here. And then the GABA is the green, so it's this one, again, going to the frontal and further into the other areas of the brain. So glutamine has many roles, and it's really important for good gut function. It's important for immunity. It's important for memories. It's important for learning. But too much of it can be a bad thing. So when its levels are high, it can cause conditions like Alzheimer's, Huntington's, ALS, OCD, schizophrenia. So too much of it. So when levels are too high, it can cause those conditions. And there's a strong link between these conditions and ADHD, especially ADHD that is not controlled. So if you were, having alcohol and drugs, which all feed that reward center, then the increased risk of getting one of these conditions is really heightened. Low levels of glutamine cause ADHD, and that's partly why people with ADHD may go towards looking for foods that are higher in glutamine, that would feed that. So MSG type foods. And I have a slide which will show you those foods that really we need to be careful around with our children and people we know who have ADHD, because it can actually cause excess in the body, in the bloodstream. Then GABA is inhibitory. It reduces neuronal excitability, so it kind of calms down that side of the brain, and it keeps everything a little bit more calm. And that's located in the hypothalamus, the thalamus, the basal ganglion, and the brainstem, as seen here. It regulates neuronal activity and overall function of the brain. So you need both. You need all your neurotransmitters, and it's just like an orchestra. You need to have them all singing together in balance, because if one is off, then it affects the other. Okay, so hyperactivity and impulsivity in adult attention deficit hyperactivity disorder is related to glutaminergic dysfunction in the anterior cingulate cortex. Impulsivity, a core symptom in patients with ADHD, has been repeatedly associated with glutaminergic neurotransmission, and pharmacology of ADHD has been shown to reduce glutamate levels in the prefrontal cortex. So basically, that's how they know that if they can lower the glutamate in the prefrontal cortex, then with drugs, then they actually can see an improvement in the symptoms. Reduced GABA concentration in ADHD hyperactivity disorder. Concentration is reduced in children with ADHD of GABA, so affecting their developmental areas of life. So that's that one. So now we're going to look at the foods where you can find hidden sources of glutamate. And I think I talked about this in my previous video about glutamate. So, obvious things that you see at the shop is you often see, so it's hidden in all these ingredients for starters. That's the first thing. There's a whole list here, which, is interesting. So hydrolyzed protein is in a lot of the vegan products. Autolyzed yeast is in lots and lots of sauces. Low-fat foods will have lots of carrageenan in to thicken them up and, to make them more palatable. So all of these foods, all of these are hidden sources of glutamate, which you need to be careful of. Then there are some products like our favorite beef oxo, which has got MSG in it, our quavers, which, kids will eat those on a regular basis, going to school as a snack. They have MSG. And then all of these other products here, I've just put up some of them just to give you an idea, all have, one or two of these ingredients, which are hidden sources of glutamate. Now, it's important to remember that glutamate that you might find in food is usually attached to a fat or a protein. So if it's in a soy protein, then it is attached to a protein and probably a fat. But if it's MSG or these individual ingredients, it's not attached to anything. It's free. And that free glutamate will cause a spike in the blood glutamate. And if you have a leaky gut, a gut that's got IBS or irritable bowel syndrome, or a dysbiotic gut where there's an imbalance in the gut microbiome, the microflora, then the cell wall, the holes in the cell wall are permeable, but they get bigger, and then they allow the glutamate to go through from the food source, and then the levels rise in the blood and they spike. And that's very different to foods that are high in glutamine. And you know, if you think the umami kind of flavored foods are the ones that are really high in glutamine, you kind of crave them, want to eat more of them. Because they're bound to a protein or a fat, they will be less likely to cause that spike. It'll be released more slowly. It's just like when you talk about diabetes and blood sugar, you know, you eat sugar without protein and fat, then you have a huge spike. But if you add some, you know, protein to it, it'll slow down that spike in fat. It won't have the same impact. So that's kind of really, you know, we can start looking at our foods, these processed foods, and remove them from the diet, which will really be beneficial to our kids and to us as individuals with, you know, it's helpful for everybody, but particularly for those of us who are super sensitive and who have these characteristics of ADHD. So then my next slide here is from Dr. Amen, who is a specialist in brain health, and his clinic, you know, does lots of SPECT scans. And this scan here is a healthy brain, and this scan here is an ADHD or ADD brain. And basically, you can see the normal brain. There isn't the dark area with the holes like here, which they look like holes, but basically it is. They're doing a task which is very focused, very concentrated, and the blood flow to these areas is decreased. Now, the more that they try and concentrate and focus, which is, you know, at school, what we push the kids to do, or as parents, we push our kids to do, come on, you know, you try a bit harder, you know, you're not really focusing, you know, try and focus. The more we push them to do that, the less blood flow that goes to that area, and it actually increases the anxiety. It increases the symptoms of the ADHD, the hyperexcitability, the you know, the lack of focus, the lack of ability to complete the task. And you know, in many ways, we just need to back off, give them space, and find another way to achieve that task by a different teaching style. And make allowances for these kids. So a healthy prefrontal cortex will help you to spend money wisely and think matters through. So you will save money in your bank as an adult if you can treat your symptoms of ADHD. You won't go and do impulse buying on Amazon or any of those shops online, which that actually is exacerbating, is fueling it, because, you know, when you do some of those impulse shoppings, you can also get that dopamine adrenaline surge that people with ADHD experience. So ADD and ADHD, it takes more effort to concentrate and can worsen the situation. The prefrontal cortex activity decreases instead of increasing. And again, I just want to reiterate, and this is going to be my kind of point going through, is that we support the struggle for better understanding of the person with ADHD, because it's a life of stress and conflict and often despair for these individuals. So unraveling the drama within is people with ADHD can be very dramatic. And I can be very much like that. You know, you'll say something for a dramatic effect. You'll say something that might trigger somebody else, and they may think that's rude or you're inconsiderate. They become very hyperactive, they become restless. And now people who hum, that's kind of a very, you know, they can't stop humming. That's a strong symptom of ADHD, and it's a self-stimulating behavior to help them focus. Another one is jigging your leg up and down, or moving. I move my hands a lot because that helps me focus, but another one is moving your leg up and down. So, you know, you could be doing a brain surgery, and that leg could need to be jigging up and down, because that will help you focus for hours on end to get through that brain surgery. Turmoil within the brain of somebody with ADHD is very common. It's not a conscious choice. I keep saying it's something that they can't help. It's a natural part of what's happening to them. So we need to be empathetic. This whole disorganized office, maybe somebody's bedroom at home, where, you know, everything is a mess. They can't find the school bag. They don't know what they've done with their pen. And no matter what they try, it's very difficult for them to organize their space. So maybe, you know, having strategies that will help them organize themselves, you know, by having little boxes to put things in. So your socks are in that box, like a basket. You know, you keep your pens in that plastic little case. You know, so it helps them to just, then they don't have, it's not much organization. They just throw them into those individual ones and have them labeled. That can maybe help some people, but for others it doesn't. Things that will really help, in my opinion, are exercise. The person running here, and my own experience. Protein, animal-based protein, really important for the neurotransmitters. Fat, really important for calming down the brain and keeping carbohydrates low, because that can tend to, and the research is showing that a lower carbohydrate diet can actually improve the symptoms of the ADHD. Meditation, and there's many other things which all help to relax and calm that mind-body down, are really important things. But you know, really compassion is one of our biggest things, and it costs nothing for people who are living with people with ADHD. The impact on life daily can be huge, because they're risk takers. They have a higher risk of injury. The risk of injury is greater because they get distracted easily. So you're cycling along the road, you could go in, and I know I'm aware of this. I can really lose my focus. I can go into a trance, and you know, I could be on a big bike ride with my husband, and then a car is coming right at me and I haven't noticed it. Head injuries are fairly common. People with ADHD have a higher incidence of being hospitalized from unintentional poisoning, being admitted to intensive care units, or have results of disabilities as a result of injuries through ADHD. Teens with ADHD are at an extra risk when driving, so that's really important. So if you're a passenger with a person with ADHD, you know, don't distract them. They need to be focused on what they're doing, because there's a lot going on the roads. I never learned to drive, and I kind of feel part of that was from my dyslexia, my ADHD tendencies, and my dyspraxia, because there is way too much going on, and I couldn't figure out, you know, how fast a car was coming. Also, I worry too much about what everybody else is doing, and my anxiety would increase. And I'm not a brilliant passenger either. And, you know, I wonder if some of that is coming from my ADHD. So need to be extra careful and avoid distractions. So driving with teens in the car, you know, no cell phones, no texting, eating, or playing the radio. Like, you know, they really need to be focused and make sure that they are not under the influence of alcohol or drugs, because that can make them drowsy when driving. 1 in 4 UK prisoners has attention deficit hyperactivity disorder. So it's a report that is 5 to 10 times higher than the general population. So, you know, again, this mindset in school that, you know, ADHD individuals with ADHD are not successful. It's not always true, but there is an element of the truth is there, because if they're not given the right skills and the right support, then they will not, you know, we're not setting them up for success. But if individuals with ADHD are given the right tools, the, you know, nutrition, the correct school environment with supportive teachers throughout their school journey, then there's no reason why they shouldn't be very successful. And we're avoiding getting in trouble with the law, we're avoiding head injuries, we're avoiding substance abuse disorders. So, you know, it's really key to their success and where they find themselves in the social environment and life. So this, talking about, you know, extremes, there are many people who do extreme sports who suffer with ADHD. Shaun White, you know, which he was called the flying tomato once upon a time. He doesn't like to be called that anymore. You know, one of the greatest snowboarders and skateboarders in the world, a complete legend. He has ADHD. Mark Andre, I put Mark up. There's on, I think it's on Prime or Amazon, yeah, Prime Amazon. It's called The Alpinist. It's down here. He was a free solo climber. He used ice picks, obviously, because he is climbing on ice, as you can see from that picture. He spoke out about his ADHD and said that climbing doesn't feel like my squirreling brain twitches. I actually, very sad about Mark. He's Canadian, and he died in 2018 on a climb. He disappeared. And it's very sad, but climbing was his escape. It was where he felt his best. It was where he felt he was thriving. And obviously, he's seeking, thrill-seeking behaviors are feeding that dopamine reward center in the brain, which we'll talk about a little bit later, and help, you know, with fueling him to do these climbs that nobody else had ever done on sheets of ice with nothing to really grip onto in treacherous conditions. The point is that, you know, people with ADHD will go out and seek behaviors to fuel that need for dopamine and to fill that void that actually, this is where I feel most alive. So we do need to provide the nutritional foundation for our kids so that they are not feeling the need to go out. And not that I'm saying, you know, I climbed when I was in BC, not much outdoors, mostly indoors with my group of Canadians. And I wasn't very good at it because I have a fear of heights, but I did love it. But you know, they may still climb, but in a more controlled environment, not in extreme conditions, but with a group of people where they're harnessed in, they're safe. You know, they have the people around them, not going off on their own to actually fill that dopamine reward center. And I think that brings me to the end of this part one. I hope you have enjoyed it. I know I've whittled on a little bit, and I apologize for that. But I hope you've learned something as well for, you know, those of you who have family members who have ADHD. And I hope you'll join me next weekend for part 2. I look forward to seeing you and hope you all have a nice weekend. And thanks for watching Nutrition with Ber. And if you'd like to work with me, this is an area that I'm passionate about and I'm very interested in. And I think I'm very empathetic because I have a child who has ADHD, and also I have ADHD, undiagnosed ADHD myself with very strong ADHD tendencies, and I'm very self-aware. I look forward to feedback in the comments. Would be great. Thank you for those of you who left the feedback on my first video, and I really appreciate your watching it. If you can give me some likes, it will also be really helpful for the channel to survive and thrive. And it's also feeds my dopamine a little bit and gives me a boost to do another video. But I will definitely be back with part 2 next week. Ciao for now. Look after yourself and remember, eat whole foods.